Well, good evening, and thank you for joining us as we kick off the Dean Suite Speaker Series. I'm Eric Spangenberg. I'm Dean of the Paul Mirage School of Business, and I'm coming to you from my home office. It's my pleasure to be here with you tonight. This is the first in a series of conversations with alumni and friends of the Paul Mirage School of Business discussing how we're working as a community to combat the COVID-19 global health crisis. And we're just doing a piece of this, of course. We want to do our part, and we're talking about that with different folks. The UCI community has acted with urgency to make a difference during this pandemic, whether through the therapeutic clinical trials at UCI Health, or creation of N95 masks by student volunteers or faculty doing research focusing on projections for flattening the curve, or discussing the ways in which our behaviors will change moving forward. We're really proud of all the innovative work of our students, faculty, friends, and alumni. Tonight, it's my pleasure to introduce to you one such individual, Paul Leon. Paul is CEO of the Illumination Foundation, a nonprofit at the forefront of the fight against homelessness in Orange County. And their work is as important today as ever as we seek to protect all of our community from the spread of COVID-19. Thank you for joining me tonight, Paul.
Thank you, Dean. Glad to be here.
Great. Well, first, I'd like to ask you briefly to describe the mission of the foundation. Given that our audience today is primarily Mirage School students, prospective students, and alumni, I wonder if you could start by telling me a little bit about your time at the Mirage School and how the foundation emerged from that experience. And I think the viewers would be very interested in hearing about the Mirage heavy composition of your leadership and your board of directors. So welcome, and let's get started here.
Thank you. Yeah, it's hard to believe that almost 15 years ago, we were at the campus at UCI, and it was actually a class project. We gathered some students together and started our own group to work with the homeless. Having not much experience at the time, I was a public health nurse for the County of Orange, the healthcare agency, and under the mentorship of Dr. Paul Feldstein and Imran Karen, we were able to start a nonprofit actually at UCI. Our first meeting was on the UCI campus. We knew very little about nonprofits, and our goal at the time was just to connect homeless to services. We had no idea at that time the actual problems that were festering with homeless individuals, and it was basically Pandora's box when we opened up. But it was a great incubator. We were able to work with many of our instructors in the HICMBA at the time. It was the HICMBA program, and we worked on strategy, finance, marketing. And who would have thought, 15 years later, here we are having to use all those skills. During the 15 years that we were in existence, we were able to maintain staff that have graduated from UCI. Many of our classmates ended up becoming board members and continue to this day to work with the Illumination Foundation. So we were homegrown, and I can't think of a better place to have started, given all the resources within Paul Mirage School of Business that we ended up tapping into in subsequent years.
Well, of course, I love hearing about the Mirage School contributing to the success of what you've been up to for 15 years. I was really struck by a comment you made this morning, and I thought you might expound a little bit on that, where you said that you've had to not only have, over the 15 years, you've used all the skills you developed in your executive MBA program, but you've had to use all of those to perform every function in the last 5 weeks or fewer in some way, shape, or form.
Yeah, well, we were really on the road. We had a grown Illumination Foundation organically. We actually started in my garage, very little budget, and we've had year over year 40% increase in our budget. And so we were well on our way with, a $20 million plus nonprofit, which was becoming a medium nonprofit working in healthcare and housing. And we saw those two um, areas as the access to help our clients get into housing, permanent supportive housing, and address their medical needs. And so within about 6 weeks ago, we got a call from the healthcare agency asking us if we would consider signing a contract with them to open up at least 7 emergency shelters to COVID positive, COVID presumptive patients that we could take in and relieve some of the stress from the hospitals, and then 5 other shelters that would take highly vulnerable homeless patients into motels that obviously Governor Newsom recommended. And so we thought about a half an hour about it and said that that was our mission. And within a weekend, our incredible staff, our CFO and our COO and myself worked on a contract which normally would take 6 months, but we actually did it in 72 hours. And it was obviously the biggest contract we've ever had. The contract was to take 1,200 homeless clients in 24/7, 7 days a week. And so we began that project about 5 weeks ago now. And we've had to use everything: negotiation, communication skills, all the finance, because with a project this big, you can imagine that if it goes sideways and you're not properly financing it, it could be disastrous for a smaller nonprofit. We were also able to use negotiation skills, and because it is a nurse-run organization, we were able to get ahead of a lot of the ordering. We had N95 masks, gowns, pulse oxes. We were uniquely qualified to set up the organization so that these shelters could really be a step-down unit for the 21 hospitals in Orange County. And so currently it's running well.
Well, I know it's rather unbelievable what some organizations have been able to do in such a short period of time, and I'm really glad to hear that you've responded and your organization's responded in such a professional and successful manner, and let's hope that continues. Why don't we talk a little bit now? I know I want to get to a few of the specifics, just because I think all of our viewers or listeners are curious about some of what's actually going on, feet on the ground kinds of things, as you face these challenges resultant to the COVID-19 and your foundation's responses. One of the things I was struck by is that I think something that you'd mentioned is that the homeless population is much more likely to contract COVID and end up in the ICU than the rest of the population. Why is that the case?
One of the really misnomers about homeless individuals is, the age of homeless individuals. Our life expectancy, yours and I, is approximately 83 years. The clients that are homeless, their average life expectancy is 48. So almost 35 years that we're looking at. And I don't know any disease process, cancer included, that can take that many years off your life. So it's well documented that if you're living unsheltered on the street, the tremendous toll it takes on your body and your immune system is incredible. So we're already dealing with seniors, basically. Our average age of homeless that we take care of is 45. So we're looking at basically 90-year-olds. They're unsheltered, an extreme amount of stress. And with the new pandemic, you could only imagine it's hard enough for us to be in our houses, and getting information, correct information. You could only imagine being on the street, not knowing what is coming next, knowing that you have these incredible elements to contend with. And basically, you're waiting to get sick. So the numbers that we gave is that our clients are 2 times more likely to be admitted to the hospital, 2 times more likely to be admitted into the ICU, and 4 times more likely to die from this virus. So it really is, a perfect storm. We've just advocated for years, that we need to get unsheltered population housed, and that we always thought it would be TB. We thought it'd be an airborne disease that came out, and when you leave people unsheltered, only bad things can happen from a public health point of view because hygiene's not there. They're basically incubators. And I think all of us know that, our clients interact with our general population 24/7, within our stores, our churches. Many times you may not know there's a homeless individual sitting right next to you, or actually interacting with you in all facets of our society. And so it is incumbent upon all of us to house homeless people as quick as we can.
Well, I mean, something you said struck me. I hadn't thought about getting information. I thought about so many of the other characteristics of the differences between homeless and the rest of us, so to speak. And I've had a lot of conversations with my staff and faculty over the last several weeks about the challenges of isolating in place, working from home, managing families, and so forth. But then when you start to think about that relative to being homeless and facing this crisis, we're really living in a privileged existence relative to these folks. And the vulnerability of these people is much more exacerbated. But I hadn't actually thought about the fact that they may not be aware of what they're facing because they don't watch TV or they don't have the internet or those kinds of things. Are there other factors that you would want to share with us about sort of the general population of homelessness, or share with the general population about homelessness?
Yeah, well, the number one myth is that, and we hear it time and time again, we hear a lot of our political leaders talk about homeless with mental health and substance abuse. Obviously, it is a certain aspect that we have to deal with, but the majority, 80% plus, are individuals who one item or another led them to be homeless. The fastest two growing populations of homeless are women with children, young children, zero to 5, and seniors. Seniors are the fastest growing population of homeless. And, I think anybody can understand that, especially in this economy, one wrong move, one health incident that could lead you into being homeless. And it's really difficult once you start on that downward cascade to get back up to where you were. And normally what happens to our young families is they start missing rents, they lose their apartment, and they think, well, we'll try a motel. That's just as expensive. And before you know it, they make the choice of living in their car. And that is just a recipe for disaster. And then they become homeless. If we can catch people before they get to that point, we can get them back into housing. So the biggest myth is that, individuals are drug addicts, mental illness. And in fact, the majority of our clients are really just looking for some assistance and actually do quite well when you just give them a hand up or get them into places where they can get reemployed or back into housing. I think I lost you there.
Mm,
There you
there we
go.
go. Okay. All right. Sorry about that. So that actually is one of the questions that some that I had originally, and then it's been reiterated by some of the folks that are associated with the school. The Dean's Leadership Circle is a networking group, primarily of alumni, but a lot of friends and people that are invested in the the community. And with so many of us practicing social distancing and working from home right now, what can we do today? What can a group like that, or what can individuals do today, from your perspective, to help with this crisis that persists through the through the COVID pandemic situation?
Well, I think you mentioned a few, and that was great that the alumni started making masks. We on our website we give a couple instances where people could not only donate, that always helps, but to different organizations. Food has become a real difficult thing for a lot of the clients that we see. Prior to the pandemic, there was food banks that had available food for our clients, and since that time, we've noticed that restaurants are closed that used to either donate or feed a lot of the unsheltered homeless. Those dried up. And so we're trying as best we can to continue to drop off food to the unsheltered. And our main goal right now is to get the unsheltered homeless into motels and into different facilities. And of course, then we can feed them and take care of them. But the one thing that we're hoping that people will keep in mind, that as soon as this pandemic is over, or at least some of the restrictions are lifted, that we have a ready made force that will come out and help us kind of rebuild where we were. We're anticipating that we're going to see hundreds, if not thousands, of new homeless who, after a short time, won't be employed, and their housing was really suspect to begin with. So we're hoping that people keep in contact with us, keep going to our website and different housing and food websites, and ready to, when that they're able to safely come out, can volunteer with us.
So is there well, more than one person, but one specifically from the Dean's Leadership Circle has asked whether or not there's a way that I guess they can weigh in, or that they can help or participate. And I suppose that's the kind of thing we'll follow up from tonight with regard to that, because we want to get the two networks involved or connected more directly. And I know that a number of people from the Mirage School actually are on your leadership team as well as on your board of directors. And so maybe we can facilitate that. Not maybe, let's go ahead and plan on facilitating a better connection in that regard with others that aren't necessarily in leadership but would like to be in servant leadership.
Yeah, it is going to take the community to really bring a lot of the things that we were doing back up to speed. We had a really accurate number of unsheltered homeless between Cal Optima, the healthcare agency, and many of the nonprofits. We were able to really get a good count for the first time in years. And that number was about 10,000 people that were actually homeless. When this ends, we're still going to have 10,000 people. That's going to be our baseline of what we're starting with, that were unsheltered. So we're going to need as many minds together to be as innovative as we can to solve a different type of problem. We anticipate that housing is going to continue to be in short supply. Obviously, limited income, and our clients were really affected by, many of them just had new jobs. They had just started. They came out of homelessness. We were able to house them. And then, before you know it, now I think the last number we looked at, 98% of our clients, and it was over 1,000 individuals we had housed, now lost their job. And so will they be able to get them back? We're not sure. We hope. But either way, it looks like it's going to be months, if not years, before they're able to go back and work.
We're making up a lot of we'll lose a lot of ground and need to make that ground up just to get back. And that's got to be one of the one of the challenges in working in your area uh, is the tide kind of coming and going, and you don't feel like you're making enough headway. And so it'll be important to have more support, additional support. One of the things you mentioned earlier that I think is important to think about is you mentioned you have a background as a in public health. You were and as a nurse run or nurse driven organization. On could you talk about that a little bit as it pertains to homelessness and how your background then specifically has helped to lead into and through this will lead us through this crisis?
Yeah, well, I had spent about 15 years being an ER and ICU nurse, and you know, before transitioning into the healthcare agency and public health. And so, our COO is also a registered nurse, a doctor in nursing, and has worked with the homeless for 20 years. She came from Boston. So, two things that were really apparent: we understood obviously the disease process, and you know both of us have worked through AIDS, SARS, H1N1, so we're really familiar with the protocol of isolation and um, different techniques for just general safety. So that really helped. But I think, when you look at nurses on the front line and all healthcare workers, without COVID, 19, it is difficult to work as a nurse. I've always tell people one of the proudest moments, and still I always lead that I'm an RN, just because the fact that it's such difficult work that you could imagine just working in a closed environment and the dangers that pose, and then now put on all that protective equipment. There's times I remember when the temperature was just so, excruciating. You're in that for 12 hours. So my hat's off to the frontline workers. We employ many of them. Many of them are young. This is the first time, well, for many of us, nothing has ever happened like this. And day after day, I keep seeing our front staff showing up for work, knowing that that potential danger is there. And, I think the only thing is that, people don't realize that the courage that it takes to know that you still have to care for people, knowing that you could get infected. And so I don't see them hesitate at all. So I think that having that experience puts us in that unique situation to where we understand what needs to be done on the medical public health part, and then combined with the fact that UCI and the leadership experience that we got through the program really helps. I mean, we learned things that really can translate well, and I consider our whole executive staff and our board of directors, we have some great business leaders on our board, and the being able to pick up the phone and call them and ask them a question and have them be able to not only give you a rational answer, but a direct solution a lot of times to what we're seeing. So we feel blessed. Had we come from a different background, it having to mitigate all the health issues, it's difficult. So that was already answered for us. And now I feel that we're in a position to make really good choices and work at the volume that we're working at.
Well, I appreciate that. And actually, I just want to, I'll take a slight tangent and suggest that that's one of the things that we were hearing consistently from some of our healthcare executive MBA students was that they wanted more exposure and interaction with the regular executive MBA students, so to speak, so that they could combine and learn more from each other. And so that's actually led to the melding of those two programs. So we still have the healthcare track, but it's within the executive MBA. And there's no business that doesn't deal with healthcare, and healthcare is always part of dealing with business. And so I'm glad to hear that even in the midst of a crisis, we're seeing and we're seeing this kind of synergy paying off, and so to speak. Um, I'll tell you what actually reminded me of you and your team was reading about you a few weeks ago in the paper, and it was, you know, the Governor Newsom's Project Room Key, and you know, the directive to utilize hotel rooms to house the homeless during the pandemic. And what a couple of things. One is, I mean, you had some great news yesterday, and we want to make sure and hear about that. And we want to hear why that makes a real difference to not just to the homeless people, but to the rest of the community. But I'd just like to get your perspective there. What makes the Illumination Foundation qualified to best serve the population within this Project Room Keep, and why did they seek you out? And then talk a little bit about the case and how you will operationalize under this ruling.
Well, yeah, again, 15 years, we weren't even thinking at the time we'd be doing this 15 years later. And here we are. So organically and grassroots, we really learned, number one, you know, the complexities of working with people that are unsheltered and the mental health issues, the substance abuse issues, the loss of jobs, and all the access to health and housing that makes it so difficult. You know, no one individual is the same. So, you know, we have 1,000 different care plans for each one of the clients that we see. And so I think one of the things we learned early on is that, you know, you have to have compassion and trust to do this type of work. And when we started working with the clients that we work with today, we saw immediate trust on their end, that they trust us and that they were listening closely to what we were saying. And once our clients trust you, they're unbelievable grateful and will comply with whatever we're trying to do as long as they're part of it. And so I think the county knew us, a lot of cities knew us. We had already been working with Judge Carter, you know, weekly on really trying to make progress on housing as many people as we could. So when Operation Room Key came up, we were well poised to do that. As a matter of fact, we had already been working with all the 14 cities, and we knew all the city council, the mayors, and we were working with them to not only build shelters, but we had two in the pipeline, and we were looking at number 3 and 4. So we were the obvious choice because we could do healthcare and take care of COVID positive because we run recuperative care. And then it just fast tracked everything on the healthcare side. And again, you know, we did get a little misunderstanding between Laguna Hills and Laguna Woods. And we definitely understood, you know, obviously everybody is tense and worried about COVID-19 and you know, the contagious, you know, manner of which it's transferred. But we also understood that by opening a place in all 5 of the districts in Orange County, that we would be able to save the hospitals an influx of homeless patients. And that was actually a benefit to each one of the communities. We have been doing this long enough that we knew we could secure one of those motels. As a matter of fact, the motels in Laguna Woods, if you drove by it, you wouldn't even see it because there's 15-foot high fences. It's all closed down. We have everything inside. We have food, we have nurses, we have a physician, and no one comes and goes unless we drive them in and out. So it's absolutely no risk to that community. And in fact, it will save that community because could keep the hospital open if we have a surge. So we kind of knew that, and we did get obviously a temporarily restraining order that a judge yesterday or Monday allowed us to continue work there. And our big hope is that when this starts to subside, that the community will understand, wow, we didn't even know they were there. And we run 16 sites right now, and neighbors don't even know we're there. So I think it will be able to show, especially South Orange County, that there is a homeless problem, and that if you face it head on and your experience and you put in all the safeguards in place, that it is a safe thing to do. And more importantly, it's a right thing to do. Many of the clients that are going in there are seniors, and we have a real compassion and understanding of seniors. So we understood why there was a fear, and hopefully we mitigated that. And the county will see, Orange County will see that it's something we can move forward so this doesn't happen again with homeless.
Well, congratulations on that. And I was very encouraged when I saw that, and then even further encouraged when you explained this morning the trickle down effect of freeing up beds. And we actually are receiving questions as we go, as we talk, as you and I talk. And rather than wait for Q&A at the end, I want to ask one now, and I'll read this to you. It says, could you discuss any steps you have taken or might take to educate the community about your work and the importance of the homeless population's health to our overall public health? Seemingly, those who protested at the Ayers Hotel could turn into advocates for your work with more education. So I think you started along those lines, but could you expound a little bit there, or what you might be doing?
Yeah, that's a great question, because two things that we started with Illumination Foundation, and again, um, we learned it in MBA school, and it was years ago, that you have to have data. And again, we learned it in marketing class that um, you have to have data, and you have to be dealing in facts, not suppositions or guessing at things. So we kept our data team in place, and it's tough for a nonprofit. Margins are thin. It's tough to get funding to keep a data team together. We ended up doing that, and we ended up keeping a marketing and communications team together. So we have this incredible data that shows the cost savings to the healthcare system. We've ran now 5 different pilot programs, national programs that are recognized, and we're getting a lot of national attention. And when you can do that and get the message out, and we've been really streaming a lot of messages to especially South Orange County, because they're not used to having a shelter. And so we've actually had a positive turn of events. We've gotten donations from Laguna Woods. We had a couple large donations, and many of the residents there said, we were for this. We wanted to do this, and it was more the minority group that was kind of led by fear and not really fact. Right now we have 250 employees. Knock on wood, we've had 0 exposures. In our shelters that we run, we have over 300 individuals in temporary shelters. None of them have been exposed. We locked them down weeks ago, and really understood the process of really eliminating movement, and spreading, and making sure social distancing, masks, washing hands. We have been really stressing that internally. So I think, to answer that question, allowing people to see what we're seeing, we're going to start a whole series of virtual tours, and we'll keep you guys involved in it, and UCI. We want people to come inside and see what we see. And we've been taking tours of people, different groups, on tours of our facility. But now, since so many people are home, I think it's going to be great that we can take them in, interview some of our clients. And I haven't in this 15 years met anyone, not one person, that when we saw what we were doing, could break bread with our clients and talk to them, haven't left and said, wow, I didn't, my impressions of homeless were the riverbed. And it's not what I thought it was. So I think we have to continue to get advocates and get that message out to as many people as we can.
I have another viewer question, and we certainly will circle back and we'll do what we can to help get that message out. But I want to move on to this next question, and I think it rises out of the discussion that you were providing a moment ago. Can you discuss what you're doing with those people that you said you have them on lockdown, and you also mentioned earlier that people they're not mentally ill, or they're not problematic. They're just paycheck to paycheck, and a paycheck didn't come. Maybe they're a flat tire from homelessness, and so they understand what's going on. But a lot of folks without the challenge of homelessness are challenged by isolation. What are you doing anything to address the mental health within, to ensure that they're positive outlook, or that they're maintaining an outlook that's optimistic?
Yeah, yeah, we're actually doing quite a bit. When I say lockdown, it's not them that we're locking down, it's the facility.
Mhm.
Obviously, they can come and go if they want. There's really nowhere for them to go. We really discourage them from just going out. But our facilities have areas where, they're outdoors. We have grass areas. We have kennels for their pets. So they can come and go in and around the facility. We just aren't transporting unless it's a medical, pretty much like all of us are doing. But we're really eliminating people coming into the facility because our clients are basically not positive, and we always do. It's not our clients that are going to affect the general public. It's going to be the other way around because the clients we deal with, they're not traveling to China or to anywhere else and not exposed to the virus as much. So the one of the other things that we learned along the way, and we were always trying to improve the program, we realized that mental health was a huge part of what we're doing. And we're not talking about schizophrenia, we're talking about depression, we're talking about minor bipolar, um, areas that people that just lost hope. And so we really instituted a real behavioral program, and it's the whole continuum. It's working with people that have depression, minor depression, bipolar, and if it's a higher level of mental health, we have a psychiatrist who works with us. And for our clients, many of them, it's getting them on their medications and really being able to work with the systems, healthcare agency, and the hospitals to make sure that their medication is at the right level. And I can tell you the success from somebody who is not able to have access to mental health, depressive medications, it is night and day. And once somebody is on their medications, they know they can have regular checkups. We've seen unbelievable somebody who was just couldn't even get up in the morning and was on the street to having a job as a crossing guard at Petco, the nicest people you want to meet. And it was just that mitigating factor of not having access to mental health. So, and of course that runs throughout the US. It's a big problem, substance abuse and mental health. Our clients have a larger incidents of that, but not much. And that's what people are really surprised about. A lot of times we trend what nationally they trend with the word suicide, depression, substance abuse. And we've really put a lot of time and effort into building those programs up.
Yeah, well, that's great. I mean, it sounds like one of the myths is that these people aren't really that much different than you or I. I think that's something that needs to be dispelled. Do we have other questions? We're not running out of time, but I think it's time that we maybe could take a few questions from those that are listening or watching. Here's someone asked, with Project Room Key, are most of the foundation's resources going toward keeping COVID at bay within the homeless population in OC, or are other programs like the mobile health clinic still happening?
Currently, we're trying to get everybody housed, and we do have the two sites that have a COVID response, a medical COVID response, where we have COVID presumptive and positive. We have one now in South Orange County, and we have one in North Orange County. So those are the two medical facilities. The other facilities are facilities that bring people off the street, so especially the vulnerable. We have some sites that are taking individuals that are over the age of 65 and that are have a heart condition, diabetes, really severe, or lung diseases. We have a couple individuals that were on O2 to begin with. So our goal is to get them off the street, and we will address their medical conditions and make sure they follow up with their physician. The really unique thing about Room Key is that we always knew that once we had a facility, we were able to do all those wraparound services. And we always felt bad because people would say, I'm lucky I got into a facility and I can receive those services. And it was just so unfair sometimes to us that saying, well, we have lucky ones that could get in our program, but we didn't have the capacity to bring everybody in. I believe this is going to be a turning point, and we're going to bring in, hundreds, if not thousands of people, and be able to start them on the road to permanent supportive housing. Um, I have to really stress that we have so many partners that we work with and other nonprofits that do this, that I think it really is going to allow us to leverage those partnerships and have the whole community help us with this.
Mhm. Uh, Another question came in here, and I think you've spoken a little bit to it, but maybe a little more specifically, looking back on the founding of the foundation, the Illumination Foundation, could you speak to your experience as a UCI healthcare MBA student and students in Capitalized, and how that prepared you and your team members for the challenges you encounter today? So, could you speak to that a little further?
Yeah, when we started out, again, having the complete program, certain things obviously, we have our several of our employees now were in our HICMA class. So some of them really gravitated towards the financial part of it. I like the marketing and the networking part of it, but we really learned how to kind of combine those strengths. And so, for me in particular, negotiating, networking, and at the time I wasn't really experienced working with the government programs, the bureaucracy, and we were able to really understand the financial part, um, the negotiation, networking, some of the networks that we were exposed to really gave us a head start on propelling our nonprofit. I have to say that our whole group, our team at UCI, we knew nothing about nonprofits. None of us had ever worked or even we volunteered, but never understanding the workings of it. So to be able to access all the resources and learn how to really develop different strategies for nonprofits really helped us. One of the things that moving forward, and believe it or not, I had this conversation with a couple of our board members who work for Fortune 500 companies, and they were saying that, many small businesses and even big businesses may go out of business because of this. And again, the strong are going to survive, but I think when we come out of this, it's going to look different, and there's going to be different opportunities. As we talked this morning, we were saying, one of the things that we really are positive about, that there's going to be new opportunities, and we've already been approached by quite a few of them, especially in housing and in healthcare. And we're really looking for people to come in and have great ideas and be innovative and take advantage of some of the great opportunities that are available. We're working right now with modular housing. We're working with a medical respite, different type of program. And, when you can bring in great minds, and we've always thought, it really helps to have experienced people, but then it helps to have people that are passionate and that have great minds and are innovative. So we're looking at hopefully networking with a lot of different universities. Our choice obviously is UCI because we're here, and to really leverage our partnership to have some of the graduating students to come to work for us. We realize also that we're looking for the next great leaders. We're all quite a bit of our staff is moving on in years, and especially me. I know we're not going to be able to do this for 5 to 10 years. We're looking at transitioning, and we're looking at for people to mentor now. And we've really found some incredible leadership. As I said, we have about 250 full-time staff, and it's unbelievable to see their growth and how they're our future nonprofit leaders. And so I always go back to UCI and speak at a lot of the classrooms there, especially in the business area and the medical school. And our messages to them is, you can be the next great leader, and don't underestimate your ability to do that, because we would have never thought in a garage in Orange County that we would start Illumination Foundation. And the way that we've been able to continue to keep our mission focused and be at at the grassroots level, and still we're a national organization that has networked with DC, Sacramento, and some large AARP is one of our big funders. But it started with just the simple compassion, ideas, and networking.
Well, I think you actually answered one of the other questions that came up, that was what's next for you and what's next for the Illumination Foundation, and you provided a lot of those thoughts. The next question that I have, that is, does the Illumination Foundation accept in-kind donations? If so, are there specific items that are most useful to the population that the foundation serves?
Yes, and again, our website, we have a list of things that we really need. You know, we have been blessed by being able to really acquire a lot of housing, and we move a lot of young families into these apartments and micro communities. Many of our clients have nothing because they came from a shelter, so we're always looking for things that, lightly used furniture, clothing, things that you might need to really equip your house if you're just starting out. And so
Okay.
we always look for in-kind donations.
And along those lines, don't you have a don't you have a an event tomorrow that you wanted to share with our viewers?
Yeah, yeah. You know, what happened was it's really amazing how, you know, a crisis like this brings a lot of people together. And the Orange County Community Foundation, we've worked with them since our inception. They had started a day of giving, and there's 18 different nonprofits that are working on the front lines with food, shelter, spiritual, just so many different aspects that are addressing the COVID crisis. And so tomorrow they have a 24-hour day of giving, and there's 18 nonprofits listed. We're one of them. It's a 1 day of donation. For us, again, it's a pass through to take that funding, and on that site, on our site and the Orange County Community Foundation, you'll see all the nonprofits. Ours in particular lists some of the things that we're going to do with the money, and it's things like getting bus passes for people that are still working and need to get to work, and you know, food's a big thing that our families are struggling with now. So I think it's a great effort by Orange County Community Foundation to bring all of us together and allow us to have a platform to raise some money for our clients.
Great. I appreciate you sharing that. So people can participate by going directly to the Illumination Foundation webpage
Correct.
or other spots, but that's the way that these listeners or viewers can chime in or can participate tomorrow. And that's for those of you who are viewing this later, that today is the 21st of April, so tomorrow is the 22nd. So 22nd of April, 24 hours. And the final viewer question, Paul, we're running close on time. Not too bad. I think this has been great. But one of the viewers wrote in and said, Dean Spangenberg, can we do this series once a week? Thank you both. And it's capital BOTH for helping us stay connected and offering educational programming in this uncertain time. So I volunteered you, Paul, to go ahead and do this once a week. I might be busy, but no, I'm just kidding. But I wanted that to be communicated that you're being thanked by the viewers as well as by me, because this is really a noble work and 15 years worth of it. And I really love that you're putting into place everything you've learned, but in particular, the last thing you mentioned was basically succession planning to ensure that this work doesn't stop and that it grows and that even more ships will rise. And when we talk about ships, I think it's something that a lot of times it's individuals, really, right? You're impacting lives one at a time. And I think a lot of academic administrators forget that as well. They think of things in terms of 3,000 students or 30,000 students, but it's actually 3,000 individual lives, 3,000 individual dreams, and and in this case, it's maybe 3,000 or it's 100 or 30 people that we're impacting, but it's one life at a time that then is going to impact several other people, and it makes a big difference. And I just want to personally thank you for all you've done and continue to do in addressing the fight against homelessness, as well as the current critical needs of the homeless. And I know from the first time I met you a few years ago, this isn't the first time you and the Illumination Foundation have set an example. I know when we first met, you shared that cities from other parts of the country have been coming to study how you're addressing the multitude of challenges that are associated with homelessness, and you're bringing an innovative approach and a business-like approach, talking about the return on the investment and those kinds of things, and the return not being money back, but lives changed and changed for the good, not just for the short term, kind of the old, teach a person to fish versus just giving them a fish. And I really appreciate that. And I warrant a guess that you'll probably again be viewed as leaders in this current crisis, and others are learning even now from the example that you're setting. So the Paul Mirage School of Business and I are proud of you and your team at the Illumination Foundation. We thank all of you for representing us well, while critically serving our community before now, and into the future. And so, thank you again for your time this evening and for the perspective and the hard work that you've put in.
Well, yeah, I appreciate it. And again, one of the things that you learn early on in not only business school, but just life in general, is that our staff is incredible. Our employees at, they do the work. They represent. If I always tell them I get too many thank yous because they're the ones that do the work. And the way they're stepping up under these incredible circumstances. We're blessed because we live in Orange County and we have a little bit more space. We were expecting a large surge and we're ready. And I know there's not many places in the nation right now today that can tell you we're ready. We
Mhm.
have staff there, they're ready to accept homeless and clients. And so we got ahead of the curve, and it's because of their compassion, their dedication, um, and so I thank them.
That I don't think there's much more to say other than thank you, and to thank those of you who are watching us. Thanks for tuning in, and I encourage you to give the Illumination Foundation website a look tonight or tomorrow, and see what it is that might pique your interest and provide opportunity for you to help as individuals. So thanks again, Paul, and
Thank you.
we'll have a great evening. Thanks,
Thank you
everybody.
and be safe.
Be safe. Be well. Bye
Thanks.
bye.